Trypophobia, the fear you didn't know you had. Subscribe to Mind Health and You for insights into mental health. Have you ever felt uncomfortable or uneasy when looking at clusters of tiny holes or patterns? This might be trypophobia, a common but misunderstood aversion to specific images, like honeycombs or lotus seed pods. In this video, we'll explore what trypophobia is, possible causes, and how it affects daily life. Disclaimer: this content is for informational purposes only and does not replace professional advice. Please consult a mental health provider if you are concerned about trypophobia or mental health. 1. What is trypophobia? Trypophobia is a reaction to clusters of small holes, bumps, or repetitive patterns. Some common triggers include honeycombs, coral, or skin patterns. The sight of these images can cause discomfort or even physical reactions, despite trypophobia not being classified as a formal phobia. Learning what trypophobia is can bring clarity to these surprising reactions. 2. Common reactions to trypophobia. People with trypophobia often experience discomfort, an overwhelming sense of unease when looking at certain patterns, sometimes with an urge to look away. Physical sensations. Some feel their skin crawl, get goosebumps, or even feel itchy or nauseous. Anxiety. The sight of clustered patterns can trigger feelings of panic or anxiety, creating an urge to avoid these images. 3. Possible causes of trypophobia. While not fully understood, several theories suggest why trypophobia might occur. Evolutionary response. Trypophobia may be a protective reaction against dangerous patterns found in poisonous animals or infectious skin conditions. Association with disease. Certain clustered patterns may subconsciously remind the brain of disease or contamination. Sensory sensitivity. Those with heightened sensitivity may react strongly to visual patterns that appear unusual or unsettling. 4. How trypophobia affects daily life. Trypophobia can impact daily experiences. Work or school. Certain images in presentations, books, or media can trigger discomfort, making it challenging to focus. Social situations. Many feel embarrassed or self-conscious about their reaction, leading them to hide their feelings. Avoidance. Some people avoid foods like strawberries or pomegranates, which may trigger discomfort due to their patterns. 5. Recognizing trypophobia in yourself. If you feel trypophobia might apply to you, consider these questions. Do you feel uneasy or distressed by clusters of small holes or patterns? Do you experience physical symptoms like itching or nausea around certain images? Do you avoid objects or images that have these patterns? If these questions resonate, you might be experiencing trypophobia. 6. Tips for managing trypophobia. Here are some strategies to help manage trypophobia. Controlled exposure. Gradually exposing yourself to mild triggers may help reduce sensitivity over time. Breathing techniques. Practicing deep breathing during discomfort can reduce anxiety. Redirect attention. Focusing on something calming around you can help minimize the reaction. Seek professional support. If trypophobia affects daily life, speaking to a therapist can provide coping strategies. 7. When to seek professional help. If trypophobia disrupts your life, consider seeking support. Therapy, especially cognitive behavioral techniques, can provide practical tools to manage triggers effectively. Final thoughts. Trypophobia may be unusual, but it's a common experience for many. Recognizing this aversion can bring understanding and relief, helping you face life's triggers with ease. If you found this video helpful, please like, subscribe to Mind Health and You, and share it with others who might benefit. Let us know in the comments if you've experienced trypophobia or have tips for managing it. Your insights might help others feel less alone. Awareness is the first step to positive change.